Now, today is World Psoriasis Day. More than 125 million people across the world suffer from this disorder, which is marked by skin that looks diseased and contagious.
Psoriasis victims are sometimes shunned by other people, so besides putting up with the physical strain of this condition, victims also have to put up with the distaste and aversion of others. To tell us more this morning, Chua, who has psoriasis, and Dr. Colin Theng, president of the Psoriasis Association of Singapore, also a consultant at the National Skin Centre. Good morning, gentlemen.
Hi, good morning.
So, Ray, maybe we can start with you. You were diagnosed with psoriasis quite some time back, but you didn't seek treatment until much later. I mean, tell us your background story.
Well, it started because I was having this thing on the scalp, and it was itchy, and I just scratched it. And then it affected my nail, and then it affected the rest of my nails, and then I was scratching other areas, and the whole area of my hand and legs started developing these plaques. Yeah, so I was like, I didn't know what to do. I went to see the doctor, and the GP didn't really know what it was. Eventually, he sent me to the National Skin Centre, and somehow they diagnosed that it was psoriasis. I had no idea what psoriasis was. I thought it was like eczema or something, but I just didn't bother about it, and the treatment and all that was a little bit troublesome to go for, so I just left it alone because it was relatively mild at that time. But about I think 5 to 6 years down, it started developing, and from small little areas it started becoming a continent.
Right.
Yeah.
Well, before we go further, maybe Dr. Theng, you can tell us a bit more. What exactly is psoriasis?
Well, psoriasis is a chronic inflammatory skin disease. So when we use the term chronic, it tends to be something that is quite long-standing and quite persistent. And so patients often present, as Ray has mentioned, with these big red patches on the skin. It commonly appears on the scalp. It can present like dandruff, but often a very severe form of dandruff where they flake a lot and you get very thick patches on the scalp. And then you can get all these red patches with scales all over the body, and elbows, knees. But just about any part of the body can be covered in psoriasis.
But Ray was mentioning something interesting which just sparked a question in me. He said he scratched it and then he started seeing signs on his finger. I mean, is it contagious in that sense?
Yeah, I think it's not contagious.
Okay.
I think that's important to realize about psoriasis. So you can shake a person's hand with psoriasis and it will not spread. But psoriasis has the potential to appear on any part of the body. So it can be on the scalp, it can come onto the hands, and it can just appear anywhere.
And how does one get it?
Well, psoriasis is probably an interplay between genetic factors and environmental factors. So for a person to develop psoriasis, there is a certain genetic predisposition, and then certain environmental factors may actually result in the expression of the genes and then the person developing psoriasis. Yes.
Sorry, one more medical question before we go further, because earlier Ray mentioned eczema as well. So for those people who are not familiar, eczema is a bit like a rash that usually younger children tend to get, right? Maybe help us understand the difference between...
That's correct. Both eczema and psoriasis are chronic skin diseases. And as you rightly pointed out, eczema often does present in childhood, where we term it as atopic eczema, where they get itchy rashes on the elbows, back of the knees, on the neck, on the flexural areas. And it often can sometimes be a bit oozy and weepy. And so it's also a chronic skin disease, but psoriasis presents a bit differently. It seldom oozes, it seldom weeps, and it just presents as very thick patches, and the scaling component is a lot more prominent in psoriasis. So they're both chronic skin conditions, but very different conditions.
Ray, I'm just trying to understand, when you were diagnosed with it, why did it take you 5-6 years before you actually sought treatment?
I think it was denial, and also because of the potential side effects. Yeah, so we know that steroids, topicals can thin the skin. Yeah, and oral medication can affect different parts of the
So how
body.
serious was the condition when you went to see the doctor and decided to
take on treatment again? It was pretty bad. 75% of my body was covered. Yeah, and it was not just about it being covered. It was like, it was so dry. I think people know it's like if you were to take your hand and wring it, just multiply that by 10 times, and we walk around with that all the time. So my normal outfit is not like that. I usually wear shorts or 3/4, and it's very comfortable, and I bring my moisturizer everywhere I go, so I can just go to the toilet conveniently too. And that's how I've been managing for years.
Okay.
Yeah.
So
but
just you had a moisturizer handy all the time, just applied it over and over again.
I have one in the office, I have one in the car, I have one I have one almost everywhere. Yeah.
Well, doctor, help us understand. So, I mean, Ray kind of left it a little bit late, but in cases where folks who do have psoriasis, Is it better to start at an earlier stage? Can it be better managed? What kind of treatments are available?
Yeah, I think so. We do advise people to seek treatment for psoriasis. So while we know that psoriasis in a way doesn't have a cure because it tends to be quite persistent, there are many, many treatments that are available that can control the psoriasis and hopefully clear the psoriasis. And so usually when it's limited, so not everybody will get a very severe form of psoriasis. So some people may just have a mild form of psoriasis, and we often would just treat them with certain topical creams like topical steroids, tar or vitamin D creams. And but sometimes the psoriasis progresses and it can be quite extensive. Then in those cases we can move on to the next line of treatment, which include things like phototherapy, using light treatment to treat the skin disease, or we even move on to oral medications or even injectable medications known as the biologics.
So you said it can't be cured, but it can be managed.
Yes.
Right? Yes. I mean, I guess that's the key. In other words, people shouldn't be fooled into thinking that I can fix it, but is being able to control what it is that you have. And Ray, for yourself now, are you at a level where you can go about your daily routine comfortably, not have to worry too much about it?
Yeah, after the medication, it was fantastic.
What was the treatment that you went through, and what sort of improvement do you see immediately?
I initially went for the UVB, that's the narrowband therapy, the one where you go into the phototherapy. That one was a bit hot. So I couldn't take it. It was like going to 2 minutes of hell and coming out, you know.
Right.
Yeah, but after that, they saw that I was struggling with that, and they said, why don't we put you on oral medication? And I was resistant to that for quite a few months after as well. And then that was where I met some friends after I wrote that song, the psoriasis song. And they encouraged me to go into treatment. And then I went to some Freedom 360 events, which was another platform together with PAS, Psoriasis Association of Singapore. And they all looked fine. I was like, are we in a psoriasis event? You know, yeah. And I asked them what they were on, and they said, oh, I was on MTX, I'm on Cyclo, I'm on Biologics, and I realized that, you know, maybe I was the bigger fool, perhaps, you know.
Well, I guess you were also concerned about side effects, which is fair enough. The doctor tell us, I mean, the side effects of some of these treatments?
Yeah, so I think most of the treatments for psoriasis do have side effects. So, for example, phototherapy, the side effects of phototherapy is very much like going to the sun. So you can get tan, there's a risk of sunburn and a slight increased risk of skin cancers. For the oral medications, for example, some of them can affect the liver, they can affect the blood counts or even the kidney and the blood pressure. But the thing is, when we use these medications, we are very stringent in our monitoring. We'll make sure that the blood tests are done, you know, the monitoring is done regularly to minimize the side effects from these medications. And even the new medications, such as the biologics, which are injectable medications that we use, in terms of the side effects on the liver, kidney, it's much less than the traditional oral medicines, but they do also, you know, reduce your immune system. So we do screen for tuberculosis, things like that, before we start the medication to make sure that it's safe while you're on the treatment.
I mean, besides managing your condition, Ray, which I think now, I mean, you're at a great place, you said is fantastic, but I also want to understand the emotional, psychological journey you went through and how it helped you. I mean, what were you experiencing before and how has it helped you now?
Okay, I think one of the biggest differences is that now when I go to like food courts or if I take buses, you know, I don't get to have that space anymore. You know, previously I just have to sit down and the whole table would scatter. You know, and then I have a lot of space. My colleagues can sit down.
That was the upside, what you're saying.
I suppose because it's a very visible condition, so when people look at you, they sort of, you know, make a judgment, I suppose, and that was difficult.
Yes, you're right. Yeah, and the emotional part of it, you know, how people view you. As it is, I think people like yourself and myself, I mean, normally we are worried about how people view us. So just imagine someone with visible psoriasis and a woman, I think it would be worse. Yeah, when they have spots on their face and all that.
So the best way is to seek treatment early.
That's right. And of course, for us to understand now that it isn't contagious. So, you know, you don't have to shun away from folks like that. And doctor, we don't have time, but just a quick yes or no, because one of the myths people have is that you get it because you have poor personal hygiene.
Definitely not.
Definitely not, right? Okay, just got to clarify that.
Raymond Chua sharing his personal experience of psoriasis, and Dr. Colin Theng, president of the Psoriasis Association of Singapore, and he's also a consultant at the National Skin Centre.
Well, if you'd like to know more about this disorder, do check out the website freedom360.com.sg.